The ketogenic diet has gained popularity as a method for weight loss and metabolic health improvement, but growing evidence suggests that it may come with significant risks. Medical professionals and nutrition experts warn that a long-term ketogenic diet could lead to severe health complications, including chronic diseases affecting the heart, kidneys, brain, and metabolism. While some studies highlight potential short-term benefits, such as weight loss and temporary blood sugar improvements, the long-term consequences of drastically reducing carbohydrate intake could be far more concerning than previously thought. One of the major concerns with the ketogenic diet is its impact on overall nutritional quality. By severely limiting carbohydrates, individuals often reduce their intake of essential nutrients found in fruits, vegetables, whole grains, and legumes. This can lead to deficiencies in critical vitamins and minerals, such as thiamine, folate, vitamin A, vitamin E, vitamin B6, calcium, magnesium, iron, and potassium. Such deficiencies may weaken the immune system, impair cognitive function, and increase the risk of developing various chronic illnesses. Additionally, the lack of fiber in the ketogenic diet can negatively affect gut health, leading to digestive issues and an imbalance in gut microbiota, which plays a crucial role in overall well-being. Recent research has identified links between the ketogenic diet and an increased risk of several serious diseases. While some initial findings suggested that ketogenic diets might help manage certain conditions like epilepsy, more recent analyses indicate that prolonged adherence to this diet could contribute to metabolic disorders, cardiovascular disease, kidney disease, and even neurological conditions like Alzheimer's. The high intake of saturated fats and animal-based proteins, common in many ketogenic diets, has been associated with higher cholesterol levels, increased inflammation, and greater risks of heart disease. Studies have also suggested that ketogenic diets may contribute to insulin resistance over time, potentially worsening conditions like type 2 diabetes rather than improving them. There are additional concerns about the potential link between ketogenic diets and cancer. Some studies suggest that high consumption of red and processed meats, often a staple in ketogenic meal plans, could be associated with an elevated risk of certain cancers. Meanwhile, many foods known to have protective effects against cancer, such as whole grains, fiber-rich fruits, and antioxidant-rich vegetables, are significantly restricted or eliminated in a ketogenic diet. While research in this area is ongoing, medical experts caution against long-term reliance on a diet that lacks these essential protective foods. Another alarming factor is the potential for accelerated cellular aging in vital organs. A 2024 study conducted on mice found that ketogenic diets led to the accumulation of senescent cells, aged cells that no longer function properly, in key organs such as the kidneys and heart. This process can trigger inflammation and contribute to the development of age-related diseases. Notably, these negative effects were observed regardless of whether the diet was high in saturated or unsaturated fats, indicating that the issue may stem from the metabolic state induced by carbohydrate restriction rather than specific types of fat intake. While further studies are needed to determine whether similar effects occur in humans, the findings suggest that prolonged adherence to a ketogenic diet may accelerate organ deterioration and increase vulnerability to chronic illnesses. Pregnant women and those trying to conceive may also face particular risks with a ketogenic diet. Some studies suggest that following a low-carb, high-fat diet before or during pregnancy could increase the risk of birth defects and gestational diabetes. A well-balanced diet rich in diverse nutrients is crucial for fetal development, and restricting carbohydrates may deprive the body of essential compounds necessary for a healthy pregnancy. Kidney health is another critical concern, as studies indicate that ketogenic diets can contribute to kidney stone formation and may exacerbate chronic kidney disease. The high intake of animal proteins and fats, common in many ketogenic diets, can increase the acid load on the kidneys, potentially leading to long-term damage. Additionally, individuals with pre-existing kidney conditions may be particularly vulnerable to the diet's strain on renal function. The ketogenic diet's effect on brain health is also a topic of debate. While some research suggests that ketones, the molecules produced when the body breaks down fat for fuel, may have short-term neuroprotective effects for individuals with conditions like Alzheimer's or Parkinson's disease. The long-term consequences are less clear. Certain studies suggest that a diet high in saturated fats and low in antioxidants may actually increase the risk of neurodegenerative diseases over time. The potential for increased oxidative stress and inflammation could contribute to cognitive decline rather than prevent it. Although the ketogenic diet may offer short-term benefits, including weight loss and temporary metabolic improvements, the accumulating body of evidence suggests that long-term adherence could have severe health consequences. The risks of nutritional deficiencies, cardiovascular disease, kidney issues, accelerated aging of vital organs, and increased susceptibility to chronic illnesses raise serious concerns about the safety of this diet. For those considering a ketogenic diet, it may be crucial to approach it with caution, ensuring that nutritional balance and long-term health are prioritized over short-term gains. Medical professionals recommend that individuals consult with healthcare providers before making drastic dietary changes, particularly those with pre-existing health conditions or those planning to maintain the diet for an extended period.